Hello, hi students. It is Dr. Karen Perez, and today we'll be discussing week 3 assignment, the nursing model change or the change in delivery, care delivery. So, what is a model of care? A model of care is a way a healthcare service or healthcare services are organized and delivered. And from that hierarchy, then you have nursing model of care. And what a nursing model of care is the way nursing care services, how it is organized and how it is delivered, who deliver it, when, where, whom, and for what purposes this care is being delivered. So there are many types of nursing model of care. So here's a few. We have the virtual case management. This is where the nurse is responsible for overseeing the quality and the financial outcome of the patient care. Then we also have and this is also the virtual case management is actually done virtually. Then we have the collaborative practice model. This is where the nurse works together with the physician in a collaborative effort. And then we have the patient centered or patient focused care. This is where we have a cross functional team and team from different healthcare professionals, different healthcare areas. So for the assignment, you should have the first slide should be your introductory slide. And what I mean by what is the name of your presentation? You should have your name, you should have the course name, you should have also the instructor name on it. And again, I may say, please do not only have words on your slides, make sure to input some graphics also. If you do not have audio on your slides, then in your notes section, you should have notes. Because if you only have PowerPoints only or bullet points, sometimes it doesn't give enough information and you may need to put the information in the notes section or then do a voiceover. And again, please do not crowd the slide with a lot of information and have it in an organized fashion. So after you have your slide with your name, the topic, the date, the class, and so forth, then you have your objective slide. Like, what is objective of this presentation? Then your background / introduction slides, then your proposed solution, and also how does this solution meet the needs for the population, and also to what steps or what is the process of implementing this proposed solution. What is the expected outcome? What is the implication? And then your conclusion. And then you should have your reference slides also. So here's an example of what a background should look like. So, more than 133 million people live with chronic condition. That number is projected to increase by more than 1% per year by 2020. And also too that because of the chronic disease management, we have that 171 billion will require care during that period. Now, your background slide gives some statistical information about and background information about chronic disease or chronic diseases or chronic disease management. So, what is my proposal to that solution? So, it has to connect. If you give me a background about something, then the solution that you have to give me should be a solution to the problem that you just gave me in the background. And for this, I have a chronic care model. And what a chronic care model is, it is a care delivery with basic elements for improving care in the healthcare system. It could be at the community level, organizational level, or patient level. So this chronic care model can be used in both inpatient and also outpatient. So, how does this solution meet the needs of the population? And the population are one with the chronic diseases. So, it meet the needs when we improve APRN and physician, because one of the things is that the amount of physician to offer healthcare services to the community has decreased. So having APRNs to be able to practice within the scope of their education will help alleviate that shortage of healthcare provider at that level. So one, using both the APRNs and the physician will help establish and make sure that guidelines are adhered to. Also improving the care coordination and planning care, and also implementing active follow-up to ensure that best outcome for the patient, and also implement effective patient education in how to manage their illnesses. This is how we will meet the needs. Now, how will you implement this model of care? So, starting a committee, and these are just examples, so yours will differ from what I have. Start a committee, gain or get additional information about what the problem is through assessment, like, okay, you know, it's a chronic disease, but who are your population? Is it young people? Is it the older population? Is it in poverty stricken areas? It is in a rural area. So do further investigation. Then also to recruit personnel and purchase infrastructure that can help with the transition of this delivery plan of care. Train personnel, because now you're having a system set up and then they need to know the system. Then implement the change, and then you want to go back and to look how effective will this change be. So again, these are just steps in how a process, how you implement the delivery model that you have decided to choose. So what is the expected outcome? The expected outcome is that there will be a reduced ER visit for people who have chronic diseases. Then the patient themselves will have better chronic disease management, and also too, which will decrease in healthcare cost. So that is expected outcome. Now, the other slide will be your discussion and the implication slides. That one, when we use this model, it can benefit patients, nurses, physicians, and the healthcare system. How does it benefit the patient? As we mentioned, we said less ER visit, better management, and also too, for example, if we have someone with diabetes and it's not been managed effectively, there's a high chance that they may have extremity eliminated because of the chronic or the side effects of diabetes. So it affects the patient in that we have healthier patient. Nurses, there will be a continuous evidence-based use practice in how to deliver care, a smooth transition in care. And the physician too, because there's a shortage, most of the time less physician and more patient. Care that is delivered is done in a rush manner. Sometimes guidelines are not adhered to. So bringing on board the APRNs then will reduce the physician patient ratio, and also increase the likelihood of adhering to guideline. And also too, please keep in mind that a high quality clinical care delivery model needs to be focused on achieving better patient outcome. So at the end of the day, the patient is the focus. So this is the implication section. And again, please remember to have your reference, use your reference, have a reference slide. So I hope this video was helpful in letting you know what is expected for your assignment coming up for week 3. If you have any questions, please feel free to send me an email, give me a call, or send me a text. Alrighty? Thank you.